there, I'm Caleb.
Oh, hey, hi. Nice to meet you, Caleb. I'm Julie.
Nice to meet you, Julie. Where are you flying from?
Oh, I'm on my way home from a conference.
Oh, what is it that you do?
Actually, I'm an ambulatory care pharmacist.
What's an ambulatory care pharmacist?
I'm a pharmacist that works in a clinic-based setting with other members of the healthcare team.
Oh, I only knew a pharmacist working in the community pharmacy where I pick up my medications. What do you do in clinic? Do you give medications to patients there?
So actually, no, I'm not involved in giving medications to patients at all. I'm part of the patient's medical team. I help manage their medications and chronic medical conditions like diabetes and high blood pressure. And I also make sure that each medication that a patient's on is appropriate.
That seems really helpful. Is there a large need for that kind of work?
Absolutely. Did you know that the majority of healthcare in America is focused on treating chronic disease? And since the main treatments for chronic disease are medications, it makes sense to involve pharmacists since we're the medication use experts.
Oh, I guess I only thought people went to the doctor when they were sick.
That's a common misperception that was true decades ago. But now, with better options to prevent and treat chronic diseases, people are living much longer. Because of this, it's much more important to manage chronic conditions such as high blood pressure and diabetes to avoid the complications that can happen over time, such as chronic kidney disease, blindness, amputations, heart attacks, strokes, and heart failure.
Oh, I think I get it. In the past, many people died from illnesses that we can now treat and prevent. So now people are living with medical conditions much longer than they used to, and they need to control those conditions to avoid health issues.
Yes, exactly. Chronic diseases are the leading cause of death and disability in the U.S. 6 out of 10 Americans live with at least one chronic disease, and 90% of healthcare spending, or over $9,000 per person, is spent on the treatment of chronic disease.
$9,000 a person sure seems like a lot.
Yeah, it is. But the good news is that we're able to live healthier, longer lives. The bad news is that it comes at quite a large expense.
So how does this connect to your role as a pharmacist in the clinic?
For one, most healthcare now takes place not in the hospital, but in the clinic setting. And second, medications are now the main way that we treat chronic diseases. In fact, medications make up 10% of our healthcare spending, so about $300 billion a year.
$300 billion, that is a ton of money.
It is, but even a bigger cost comes from the side effects, drug interactions, illness, and death caused by people taking medications incorrectly. This accounts for about 16% of our healthcare spending, so about $500 billion a year.
That is horrible. Something should be done about that.
I completely agree, and that's where the role of the ambulatory care pharmacist comes in. We're the drug experts, the most highly trained member of the healthcare team in medication use.
Wait, so do you know more about medications than doctors?
I certainly think so. Pharmacist training is focused exclusively on the use of medications. We complete a 4-year Doctor of Pharmacy degree after our undergraduate training, and then many of us complete 1 or 2 years of postgraduate residency training after that and then become board certified.
Wow, I had no idea that pharmacists had that much education or training. What is it that pharmacists in the clinics do exactly?
Ambulatory care pharmacists are part of a multidisciplinary team. So while physicians are experts in diagnosis of medical conditions, pharmacists are experts in the management of medications to treat the conditions once they're diagnosed. So together, the physician and the pharmacist works with the patients to manage chronic conditions and medications safely and effectively.
That makes sense. We certainly live in a more complex world than we used to, and knowledge is always expanding.
Exactly. So ambulatory care pharmacists help in selecting and dosing medications and making sure that those medications are appropriate for each individual patient based on their specific medical needs, such as kidney and liver function, other health conditions, and other medications that they might be on. Pharmacists also help patients use their medications appropriately because on average, half of all medications taken for chronic diseases are not taken correctly.
Yeah, my mom has like 10 different medications, and I'm always worried that she's either not taking them correctly, or maybe there's an interaction. And honestly, I don't know if she even needs them all.
Yeah, it may be good to check to see if her clinic's medical team includes a pharmacist and ask if she can meet with them.
So does not every clinic have a pharmacist?
Unfortunately, no. Ambulatory care pharmacy is a relatively new field, and while it is growing, there are barriers to its growth.
What kinds of barriers?
For one, pharmacists are not yet recognized as medical providers, and this affects how they can be reimbursed for their services, which limits their ability to help more patients and improve the quality and cost effectiveness of their healthcare.
So how is this possible with all the training and expertise that you told me about?
That is a great and complicated question. A very oversimplified answer is that many years ago, when our current healthcare system was just developing, pharmacists were aligned with the oversight and medication distribution. And this is still a critical role for pharmacists, but with increased complexity of healthcare, the role of the pharmacist has expanded to assume responsibility and accountability for managing medication therapy, like what we've just been talking about.
So is there anything that's being done to allow more pharmacists to work in medication management?
Pharmacists are working on both a state and a national level to be recognized as medical providers. And part of that work is educating consumers like yourself, legislators, and other healthcare providers and administrators on the value that pharmacists can bring to healthcare if allowed to practice at their full capacity.
So do only clinic-based pharmacists perform this role? Or does this happen in the pharmacy where I pick up my medications too?
To various extents, certain community pharmacists are involved in this role as well. There are some things unique, however, to the ambulatory care setting that allow pharmacists in this setting to fulfill the role more fully. First, we're not dispensing medications, so our entire focus can be on the proper use of medications. Second, the ambulatory care pharmacist generally works directly with other members of the healthcare team, and this just allows us to strengthen relationships and build trust. And third, ambulatory care pharmacists have full access to and document in the electronic medical record.
Wow, that is all very interesting. I'm going to find out if my mom's clinic has a pharmacist. Thank you for teaching me about how important clinic pharmacists are in keeping patients safe and healthy.
Yeah, you're welcome. It was really nice talking to you, and best of luck with your mother.
Thank you.